In healthcare facilities, isolation represents one of several measures that can be taken to implement in infection control. The prevention of communicable diseases from being transmitted from a patient to other patients, healthcare workers, and visitors, or from outsiders to a particular patient. Various forms of isolation exist, in some of which contact procedures are modified, and others in which the patient is kept away from all other people. In a system devised, and periodically revised, by the U.S. Centers for Disease Control and Prevention, various levels of patient isolation comprise application of one or more formally described precaution. Isolation is most commonly used when a patient is known to have a contagious. Dedicated isolation wards may be pre-built into hospitals, or isolation units may be temporarily designated in facilities in the midst of an epidemic emergency. Isolation should not be confused with quarantine or biocontainment. Quarantine is the compulsory separation and confinement, with restriction of movement, of individuals or groups who have potentially been exposed to an infectious microorganism, to prevent further infections, should infection occur. Biocontainment refers to laboratory biosafety in microbiology laboratories in which the physical containment of highly pathogenic organisms is accomplished through built-in engineering controls. When isolation is applied to a community or a geographic area, it is known as a cordon sanitaire. Reverse isolation of a community, to protect its inhabitants from coming into contact with an infectious disease, is known as protective sequestration. Contagious diseases can spread to others through various forms. 4 types of infectious disease. Transmission can occur, depending on the contagious disease. Transmission can occur within a person's home, school, worksite, healthcare facility, and other shared spaces within the community. Even if a person takes all necessary precautions to protect oneself from disease, such as being up to date with vaccines and practicing good hygiene, he or she can still get sick. Some people may not be able to protect themselves from diseases and may develop serious complications if they contract the disease. Therefore, disease isolation is an important infection prevention and control practice used to protect others from disease. Disease isolation can prevent healthcare-acquired infections of hospital-acquired infections, reduce threats of antibiotic-resistance infections, and respond to new and emerging infectious disease threats globally. The U.S. Centers for Disease Control and Prevention created various levels of disease isolation. These precautions are also reviewed and revised by the CDC. Universal precautions refer to the practice, in medicine, of avoiding contact with patients' bodily fluids by means of the wearing of non-porous articles such as medical gloves, goggles, and face shields. The practice was widely introduced in 1985–88. In 1987, the practice of universal precautions was adjusted by a set of rules known as body substance isolation. In 1996, both practices were replaced by the latest approach known as standard precautions. Use of personal protective equipment is now recommended in all health settings. Transmission-based precautions are additional infection control precautions over and above universal standard precautions and the latest routine infection prevention and control practices applied for patients who are known or suspected to be infected or colonized with infectious agents, including certain epidemiologically important pathogens. The latter require additional control measures to effectively prevent transmission. There are 3 types of transmission-based precautions. According to the CDC, isolation is the act of separating a sick individual with a contagious disease from healthy individuals without that contagious disease in order to protect the general public from exposure of a contagious disease. Special equipment is used in the management of patients in the various forms of isolation. These most commonly include items of personal protective equipment and engineering controls. Dedicated isolation wards may be pre-built into hospitals, or isolation units may be temporarily designated in facilities in the midst of an epidemic emergency. Many forms of isolation exist. Contact isolation is used to prevent the spread of diseases that can be spread through contact with open wounds, Healthcare workers making contact with a patient on contact isolation are required to wear gloves, and in some cases, a gown. Respiratory isolation is used for diseases that are spread through particles that are exhaled. Those having contact with or exposure to such a patient are required to wear a mask. Reverse isolation is a way to prevent a patient in a compromised health situation from being contaminated by other people or objects. It often involves the use of laminar airflow and mechany.